I'm Frank Giannotta with Raleigh Orthopedic Therapy. Welcome to our clinic and congratulations on your brand new knee. We know you've been through a major procedure, and we also know that you're eager to get back to all the activities that you need and want to do. We're here to help you reach your goals, and you'll be working with some of the best and most experienced therapists in the area. But keep in mind, the single biggest factor in your recovery is your participation. So we've made this video to teach you some important details on what you can do to ensure the best possible outcome. Our priority in the first few weeks of rehab is to maximize the range of motion in your knee. That simply means that we want to maximize your knee's ability to bend, which we call knee flexion, as well as your knee's ability to fully straighten, which we call extension. We'll be working on your range of motion here in the clinic, and there are many ways that you can work on your range of motion at home. For knee flexion, you could do seated heel slides, lying heel slides, stair stretches, or squats. For knee extension, you could do seated heel props with or without weight, lying heel props with or without weight, or prone leg hangs, again with or without weight. And these are just a few examples. Whichever stretches your therapist assigns for you, they need to be done multiple times per day. And here's the really hard part. The stretches need to be somewhat painful, or at least uncomfortable. Otherwise, you aren't going to make much progress. The more discomfort you can tolerate with these stretches now, the easier time you'll have later on, and the better your final outcome is likely to be. This is one reason to follow your doctor's recommendations regarding pain medication. The better your pain is controlled, the better you can tolerate the stretches. Everybody needs to use an assistive device to walk after a knee replacement. The most common progression is to first use a walker for several days to several weeks, then progress to a cane for several days to several weeks. And our goal for most patients is to eventually walk safely without any assistive device at all. Transitioning from walker to cane or from cane to nothing usually depends on two things. Number one is your comfort. Do you feel safe? Do you feel stable and secure? And are you confident that your knee will support you? And number two, your gait. Are you able to walk with a normal gait? Until your strength and range of motion have returned, an assistive device will help you walk with a more normal gait so that you don't overly stress other joints. Your therapist will help with these transitions. Pain and swelling in your knee is a normal part of the process, but if your pain and swelling is excessive, it can negatively impact your recovery. It's important to take your pain medications as your doctor prescribed. Controlling your pain will make you more comfortable and will improve your ability to participate in the rehab exercises. For the swelling, when you're resting at home, try to keep your leg elevated. Having your knee above your heart is ideal, but at a minimum, try to keep your foot off the floor. A cold pack on your knee will further assist with swelling control and can be done several times throughout the day. We encourage you to be active and to do as much walking as you feel up to. However, it is possible to overdo your activities, which will result in more pain and more swelling and potentially set you back in your recovery. So you'll need to find the amount of activity that you can tolerate without setting yourself back. A noticeable increase in pain and swelling is your body telling you that you've done too much. As your incision heals, scar tissue forms inside and can bind the skin down to the tissue underneath. This in turn can be painful as well as limit your range of motion. So when your staples are removed and your incision is completely closed, you can begin mobilizing the scar. With your knee bent, place your fingers on each side of the incision. Move the skin up and down and side to side. You can also place your fingers directly on the incision and move the skin up and down and side to side. So let's review the main points to remember. Number 1, gaining range of motion is our priority for the first several weeks. Number 2, use an assistive device as recommended by your therapist. Number 3, controlling pain and swelling will make you more comfortable and will make your range of motion easier. Take your pain medications as directed and use ice and elevation frequently throughout the day. Number 4, be active, but not so active that you exacerbate your pain and swelling. And number 5, mobilize your scar when instructed by your therapist. So that's it. Your physical therapist will give you specific instructions and exercises for your particular situation, and will work to ensure that you progress according to your surgeon's instructions. Thanks for watching, and good luck with your rehab.